Namaste. I'm Dr. Aswin Kumar, working as academic head at Asha Neuromodulation Clinic, Gachibowli. What is transcranial magnetic stimulation? Transcranial. Cranium is the skull bone. It's a technical term of it. And I'm sending something across the bone, across the skull. That means transcranial. What am I doing transcranially? I am stimulating the brain using a magnetic field. A transcranial magnetic stimulation. TMS is actually a component of a set of treatments called non-invasive brain stimulation. By the word non-invasive, I mean that we are not inducing any kind of injection, drug, anesthesia or surgical intervention. It is purely non-invasive. So we will be just sending some energy, some form of physical energy into the brain, and in this case it is magnetic field. Where does the concept actually come from? Way back in 1985, Dr. Barker and his team in England, they worked for the first time. What did they do is, they wanted to stimulate the brain with a magnetic pulse. And the moment they were choosing a particular part over the brain, what we call as motor cortex, and when they were sending a single magnetic pulse, you know what did they observe? They observed some part of the body, say the right hand thumb, it got twitched. Twitch is an involuntary momentary contraction. Okay, so that means they have understood that if I can send a brief magnetic pulse into the brain, it can somehow activate the neurons, and the activated neurons will in turn activate the muscle getting a twitch. By sending a magnetic pulse, if I am able to stimulate brain, then why not stimulate other parts of the brain which are affected in some disease or some pathology. So these studies in 1985 paved the way to find out the technology behind TMS. The technology is also quite simple. We all need to go back into our 10th class or 9th class, the fundamentals of physics. Electromagnets. We all know that there are naturally existing magnets and also an electromagnet which can be created. So an electromagnet, what does it contain basically is the series of wires of copper, maybe or may not be wound around an iron core. Okay, and when an alternating current is sent into this coil, obviously there is a magnetic field created. So how am I generating a magnetic field in my TMS also? I am generating using an electromagnet. And what is an electromagnet here? The copper wire or a coil that conducts electricity. So this copper wire is kept in an insulated case so that the patient will never feel the effect of the current. The current flows in a coil, and that generates a magnetic field. It's the field alone that enters into the brain. And once this alternating magnetic field which is generated through this electromagnet enters into the brain, and that induces an electric current inside the brain by means of Faraday's electromagnetic induction. So this induced current inside the brain is what is making a difference. And now don't you wonder how current is actually trying to make a change in the neuronal activity or the behavior. You know, this cute little area of the head I call as brain, it's so wonderful. It's some magic which is created in the nature, holds about 100 billions of neurons, not just one or two, and even double the number of other connective tissue cells called glial cells. So all these cells which are packed up very, very closely in this tiny volume of the skull, they are all electrically active particles. These cells are all electrically active. They communicate by means of currents. But of course these currents are in the amplitude ranges of microvolts, but still these are all electric beings. So because they are all electric beings and current is the major way of communication or exchange of information between them, by inducing a current in the area, definitely we will be inducing the change in a particular or a desired direction, a change in the behavior of these neurons. Alright, so we have tried to understand what is the basic technique in TMS, and we have also known that this TMS is non-invasive and it is painless and it is quite safer. So I said in 1985 What happened? Dr. Barker et al. Or their team, scientific team, they have found that the magnetic pulse can be able to stimulate the brain and produce a twitch, right? Later on, after some years, around somewhere in 2003, another set of scientists, what did they do is, they have taken a PET scan, positron emission tomography, PET scan of a patient with depression and a normal individual. And they have found that certain areas in the brain are having a lowered function. That means the blood flow in that area is little lesser compared to the adjacent areas. Okay. And by this they could find out the areas which are specifically inactivated in depression patients. And this finding has produced some curiosity in scientists that whether I can generate a magnetic field and then send it to this area of a depressed patient, so that I want to see if the patient comes out of depression. Alright, so such studies have been carried on by many scientists through these last 20 years, and many different protocols have been generated, and few of them were approved by US FDA, few of them are approved by European Union, and now scientists and clinicians across the globe are using TMS. TMS basically has three types: a single pulse TMS, a paired pulse TMS, and a repetitive TMS. Single pulse, like how the scientist Barker did. I'm sending a single pulse into the brain to know the excitable status of the brain. Okay. There is a paired pulse TMS, wherein I distance or I separate the two pulses with some variable time gaps, and then I want to see the effect of the second pulse over the first one. It's in the research side. And now coming to the third one, the repetitive TMS, wherein a set or a cluster of magnetic pulses are sent into the brain. So when I send the magnetic pulses not as a single one or as a pair, but as a group of pulses together, I call it as repetitive TMS. So this is all about the technique and the types of TMS. We will meet in my next video, wherein I am going to explain to you in detail the effects of the magnetic field in the human brain. Thank you.